in my opinion, there is not a better profession out there to implement the Natural Medicines Health Act or other iterations of that in other states, psychedelic-assisted therapy, than naturopathic doctors. We are the only profession that gets trained in all the areas that I think are requisite to really provide that care at the highest level possible.
All right, welcome to the Alternative Flight Plan podcast again. This is where we explore the healing paths your regular medical provider may not tell you about. Throughout over 2 decades in the Naval Service, I've learned that creativity and adaptability are really key to solving complex problems, especially when it comes to healthcare. It's here we go from the aviation ready room to the medical treatment room to help you, the listener, learn more about how to navigate health in today's environment. My guest today is a really good friend of mine, Dr. Ryan Phillips, naturopathic doctor, board-certified biofeedback provider, certified psychedelic-assisted therapy provider, and a lot more. But I'm going to have Ryan help me unpack that because he's got so many tools in his toolkit that I don't want to spoil all the fun. Today, we're going to dive into a space that's more centered on naturopathic medicine and what NDs and NMDs, naturopathic medical doctors, have to offer. Ryan's clinic, the Transcendent Integrative Health Clinic, has applied to be among the first clinics in Colorado to be officially licensed to provide psilocybin, which is pretty exciting. So we're also going to delve into the behind the scenes and the bureaucracy and how he's working through substantial hurdles to get entheogenic medicine to the forefront of healing mental health in Colorado. So without further ado, let's taxi to the catapult and get airborne. Ryan, welcome.
Thank you. It's great to be here and great to see you again.
Awesome. It's funny. Ryan and I met in medical school and we did an epic journey to Tibet together with a number of other people where we cycled from Lhasa, Tibet, to the base camp of Mount Everest over the course of, I think it was like 10 or 12 days. And we got to know each other really well. And I love his philosophy on life and the fact that he and his 8-year-old son cycled from Lhasa to the base camp of Mount Everest. So that should give you a little bit of an idea of his character and determination and drive. So with that, Ryan, why don't you tell us a little bit about what you're doing? Let's just start with the basics. What are you doing?
Well, my specialty over the last several years of practice has really become in this mind-body integrative mental health space that addresses the psychological and physiological aspects of not just mental health conditions, but physical health conditions as well. And really focusing in on all of the people that are in the kind of lost in the chasm between conventional and alternative, between mental health and physical health, to really fill in a huge gap of our healthcare system.
So you think, well, let me put it this way. You talked about a number of different gaps in there. You talked about the gap between conventional and alternative. Ryan and I did a practice call yesterday, and we both agree that alternative is really a misnomer. Just traditional, we'll just call it traditional world medicine. So there's a gap between the conventional and traditional, and a gap between the physical and the mental. I'm really curious about the gap that you see between physical and mental.
Well, I mean, if we want to trace this all the way back, we can go all the way back to Cartesian dualism, back in Enlightenment philosophy, and why we as Western people in particular have this mind-body disconnect. These have really, really deep cultural and philosophical roots. And that model is very outdated based on the research, but our medical system was really founded upon that idea that the mind and body are completely disparate. We have separate fields, we have separate, professions that deal with mental health and physical health, and they're functionally treated as if those two things have no bearing on each other at all. And our understanding of that has progressed beyond it, but our system still has a huge partition between the mental health and the physical health fields. And it's left most people stranded in the gap in between.
Ryan, one of the things I know about you is you spent a significant time living outside of the United States. And I'm curious how that experience, if you could just describe what that was for the audience, how that experience has informed your beliefs and values on bringing together the physical and the mental and spiritual.
Yeah, that time overseas was really critical. I mean, my background is I actually grew up on a popcorn farm in southern Indiana in the '80s in a very politically and religiously conservative environment. I mean, I always joke that I'm the least likely naturopath and the definitely the least likely psychedelic-assisted therapist out there. Nothing in, the area that I came from would have set me up for this. But whenever I was living overseas, I spent about 12 years living in South Asia, mostly in India, sometime in India, a little bit of time in China. I'm sorry, sometime in Nepal, a little bit of time in China, a little bit of time in the Philippines. But about 10 of those 12 years was spent in northern India, up in the Himalayas. And about half of that time I spent living in a Buddhist community, and about half of that time I spent living in a Hindu community doing public health and community development work. And as I was living in those communities, I was exposed to a whole different way of thinking, a whole different way of being. And it really began to unknit a lot of the assumptions and the beliefs that I had and had been given to me as I was growing up, and opened the doors to a much broader, more integrative, or holistic, whatever we want to label it, way of looking at life, at health, at existence, and about our place in this world. So I'm very, very grateful to the Nepali communities that I lived in and everything that they taught me, because without their example and what I learned from them, I definitely wouldn't be sitting in this chair here today.
Yeah, I think one of the things that you did over there really translates to what you're doing today, and that was your involvement in a not-for-profit. And I think that drive to bring services to people that need it is so important in the work we do today. We had a long conversation yesterday about how we make psychedelic assisted therapy accessible to the people that really need it, not just the wealthy people that want to have a fun experience. Why don't you tell us a little bit more about your nonprofit and how that type of work is filtering through in what you're doing today?
Well, yeah, there's a lot of connection actually. And I'm not exactly sure where I got a lot of my ideas and my convictions early on, if they were just my own or where they came from. But even the work that my wife Amanda and I did in India, we approached it in a very different way. And in nonprofit work, like in international development, the norm out there is that you have this big program, you have this agenda, you have these goals that you're going to meet. You use this whole plan to gain funding, and then you have to deliver on those goals that you set up. So really, as an outsider, you're coming in saying, I see you're broken, I want to fix you, here's how I'm going to fix you, and I have access to resources because I'm in the one in position to fix your problems. We took a 180-degree different approach to our work in northern India, where we moved into the most remote community in that part of the Himalayas we could find. And we came in with no funding, no plan, and no agenda. And we asked people, what's going on? What are your biggest problems, and how would you solve them? And our approach was all about using local resources and empowering local people to be the solution to their own problems, instead of coming in from as an outside expert to fix a problem or fix a community, fix an issue. It was really entrusting in that community's natural or innate capacities to really solve their own problems, rather than trying to be, a white or Western savior coming in.
That's fantastic because we're doing the exact same thing with psychedelic medicine and using something that's been used culturally as a traditional medicine. We are trying to fight back against the westernization and the colonial model of using that to solve our problems. I would love the collaboration of both the traditional and the Western because I think there's good things in both of those um, to make it the most effective medicine for where we are as a nation and a culture in America. Does that make sense?
Hmm. Yeah.
Um, so many places I want to go with you. It's like which one do I want to start with? Um, I'd like to know a little bit more about your clinic and the path in the different clinics that you've experienced, um, because what you're trying to build is something that's truly integrative. So if you could give us a little bit of a description of what it is that you are building and how that's going to fit into the psychedelic model, uh, that might be helpful.
Yeah, well, I kind of have my practice in two different places. One you already mentioned, Transcendent Integrative Health. I started early last year as the entity to get licensed to be one of the first licensed healing centers in Colorado. And for those of you who aren't used to the Colorado nomenclature, healing center means a licensed facility that you can do psychedelic assisted therapy at. But specifically, that's under the Natural Medicines Health Act. And in Colorado, natural medicines means naturally occurring psychedelic compounds. So right now, the only one of the compounds that is legal for clinical use in Colorado is psilocybin. But the way that the law is drafted, in the future, we can add on ibogaine and non-peyote mescaline. We can also add on DMT. So this is kind of the psilocybin is kind of the test case in the Colorado Healing Center model of what natural psychedelics we can use for really deep psychological healing and transformation. So I'm trying to pioneer, this clinic through Transcendent Integrative Health, but I'm also part of a group practice, and it's called Neurogrove. And Neurogrove is more of an integrative mental health practice where we have LCSWs, LPCs, somatic therapists. We have neurofeedback, biofeedback, naturopathic medicine, ketamine assisted therapy, IV therapy. And we're taking a really comprehensive approach of addressing both the psychological and the physiological components to mental health challenges in our patients and clients.
I can only imagine that might be a little bit challenging to balance the flow of all those different tools that you have.
Yeah, that this is actually something I've been talking a lot about lately and something I'm really passionate about. So, what I find in a lot of, quote unquote complementary alternative holistic practices is that there is this buffet of modalities to pick from, right? And you go up and you go, oh, I want a little bit of body work and I want some acupuncture and how about some lab testing and a little bit of this and a little bit of that. And it's good that in this space we provide a lot of options for people, which people aren't used to having options. They're used to having algorithms that tell them what their treatment's going to be. And so that's good. But, you know, if you've ever gone to, a cheesy buffet, let's say the Golden Corral, right? You go and you're like, oh yeah, I'll get some chicken wings, and I'm also going to get some chow mein, and I'm also going to get a Caesar salad, and then you bring it back to your table, and it's like any one of those foods is like maybe desirable, but the combo, it's like fried chicken, like chow mein, and a Caesar salad. You're like, you get back to your table, and you're like, wait a second, this doesn't. These are all good things, but they don't pair well together. They're not integrated. So I really think the next step in integrative care is moving beyond this like fee for service, a la carte model where we're really treating alternative, complementary, holistic, whatever you want to label it, health modalities like a buffet to where I want to move towards is how do we have this more like sitting down to an expertly crafted 5 course meal, right? That has a progression, that has an integration where all the different modalities and services pair together in a very intentional way to to progress in a certain way, but then also to work synergistically with each other. I think that's really what we need to see more of in this space.
I can only imagine, uh, and it's not even I imagine, I've seen it work just based on my own personal experience and watching other people go through psychedelic assisted therapy, that when you add the element of something that is so transformative or has the potential to be so transformative, that flow and that ability to craft a, 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 a finely crafted 5 course meal, as you said, is that much more important.
Yeah, and just the overall experience and the way it makes you feel. right? I mean, who walks out of a Golden Corral feeling good about themselves? I know I never have.
Oh my God.
But when you
No.
get down to just a really beautiful meal, the way it makes you feel, but then also who you share it with is it's not about just the food. It's about the presentation. It's about the order, the progression, the environment. And you can walk out of one meal, feeling really bad about yourself, and you can walk out of another meal feeling nourished, and that is really what I think where we need to be headed in this, integrative health space is really how to make all of these things work together in a really synergistic and sensible way, which I don't see nearly enough of out there.
I couldn't agree more. And then the next comment is always, well, a really fine meal at a, you know, really expensive restaurant is just that, it's expensive. And you and I have talked at length about the challenges in getting people to see the value of the investment and actually investing in something that is alternative and not covered by insurance. How do you see that progressing with the naturopathic community? And then take that one step further. And where do you see that going with the psychedelic assisted therapy community, whether that be ketamine or psilocybin or anything else?
Yeah, this is a huge topic, and it's one that's really important to me. The thing that got me into healthcare in the first place was trying to make healthcare and medicine accessible in one of the poorest parts of the world. That's how I got my start, right? And healthcare access and equity is really important to me, but it's also really challenging as an ND who is often sidelined or discriminated against within the current healthcare system. I mean, even in the states that we can have like Medicaid and insurance coverage. We often get reimbursed at lower rates than even PAs and NPs get, even though we are trained to the level of primary care physician, right? So we really, um, the system isn't set up to pay us what we're worth. And the other thing is that we often, instead of spending 12 or 15 minutes, we're spending 30, 45, an hour, hour and a half. So we're getting paid less for even more work. And we're also analyzing cases at a much higher level, kind of using a systems thinking model rather than a reductive model to see how all these disparate parts of somebody's health are interlinked. And so access and equity is really important to me, but we have a current healthcare system that doesn't really allow for that. So that forces a lot of us in this space into cash based practice. And, if we were to really charge what we're worth, we- I just don't think that we would have very many patients. You know, even for me, in the position that I'm in, the common story that I hear when by the time people get to my care is, oh, I've been to a neurologist and I've been to a psychiatrist and I've worked with my counselor and I've been to my primary care physician and a gastroenterologist and I haven't gotten any better and now I'm here to see you. Right? If in the healthcare system, as you escalate up that specialty chain, care gets more and more expensive, right? And I'm charging about the same amount that their primary care physician is charging all the way back at the beginning of that equation. So um, I really think that naturopathic doctors are well trained and trained in a way to do something in this healthcare system that no one else is. But it is very hard for us to actually charge what we're worth and to have fair compensation for the level of expertise we bring into the equation. So that's the challenge. Like I care about this. This is important, but I also have to pay off those student loans. I have to keep the lights on. I have to have, a decent standard of living, take care of my 4 kids. So it's a very, very hard balance to strike in this space. Um, and it's not that naturopathic doctors are greedy or exploitative. It's that we are fighting an uphill battle to survive economically with a whole system that's stacked against us. And that's why oftentimes our rates are so much higher. The other thing that's hard with this is that people perceive our rates as higher, right? If they come and see me for an hour and a half visit and I charge $400, right, that feels very expensive to people that person is going to go get 15 minutes of care from their primary care physician, and insurance is going to be billed that same amount, but the patient isn't going to see that billing directly. They're just going to see their $20 copay, right?
It's a really frustrating system because the level of care that we have the ability to do, and I know many of us actually start out like I did, right, doing primary care, doing 30-minute visits, getting reimbursed by Medicaid, and reasons to prepare. And I think it was a good way to start to get a glimpse at what is going on with the conventional healthcare system. But also, I looked at the reimbursements that were denied on legitimately billed things, and the amount, like, I might have gotten for an hour's worth of work, I might have gotten 36 or $45, and that barely pays my salary, never mind what the clinic director was trying to do and keep the doors open and the lights on for the space that he was providing us. I think a lot of people don't understand also the hidden costs behind being a medical provider. And in the state of Washington and Colorado and a lot of states, naturopathic doctors are medical providers. And so I need a license. I carry two of them. Those are expensive. I do continuing education, and much like you, I've done some really extensive continuing education. I'm just going to say the number, and nobody's going to believe me, but this is this is what it was. I spent a total between travel and fees and classes. I spent $18,000 last year on continuing education. And a lot of that was the psychedelic-assisted therapy curriculum, right? That was not cheap. And I know you did the same course, but people don't realize how much more education it requires after medical school to become really good at whatever your special interest is.
Yeah, and I'll add to that. Sorry to cut you off. I'll add to that. If you're going into a large hospital system as an MD or a DO or a PA, a lot of that additional training will be baked into the workplace. Whereas whenever you see an ND with, whatever it is, I think I've got 16 letters after my name now or something like that. Like, I paid for all of those letters and I worked hard and I didn't have any support or any guidance. Like, I pursued those out of a place of passion and dedication to my profession and my craft. And like you, yeah, I mean, I spent around 20 plus $1,000 on continuing education and additional training last year. And on top of that, to be one of the first psilocybin facilitators in this state, I had to apply for, on top of my other licenses, for additional licenses, which are costing me about $8,000 or $10,000 a year.
Yeah, so that that goes to the next comment about why is psychedelic assisted therapy in existing places like Oregon so expensive? And because I looked into the Oregon thing, I was considering trying to be a facilitator in Oregon somehow. But the if I'm correct, and I can verify this after the show, but if I'm correct, the grower's license alone was $10,000. And you think about that's just the license. That's not the leading up to the license. That's not the equipment. I mean, we can go off on this all day, but I don't think people realize the bureaucracy behind what regulation, and I think regulation is good. And on some levels, decrim is a whole nother conversation, but if we're going to regulate this to make sure that we don't harm people, uh, I think it's important to have these things in place, but the bureaucracy can be a killer.
Yeah. Well, I mean, I think there's a couple reasons why, like, say, psilocybin assisted therapy is as expensive as it is. You've already talked about the cost of bureaucracy and regulation. And that is, as this rolls out in, multiple states now. New Mexico's passed a bill, Arizona's passed a bill. Like, this is going to become legal in a good portion of the states in America. And a big thing that's going to, double or triple the cost of this is that regulation and the bureaucracy. But another thing too is the time. With every psilocybin journey that I've guided over the last 2 years, um, we're doing 2 hours of prep work on the front end. We're doing 2 hours at least of integration work on the tail end. The average psilocybin journey it's gonna be about 8 to 9 hours of my time, start to finish, between setup, teardown, and the 6 to 8 hours that somebody is under the influence of psilocybin. And then there's all the the paperwork and the charting and everything outside of it. So 15, 16 hours of my time. You're paying for that much time with someone who is really highly qualified and has gone to great expense to be able to provide that service to you. Unfortunately, that part of it, well, you can't sweep those costs under the rug. I mean, if you were to pay for 16 hours of counseling, right, at about $150 an hour, what would that work out to be? Actually, what you're getting with a psilocybin journey is actually you're getting a lot more for your money than you are with most other services. And on top of that, the efficacy rates, not only are you getting more time and more attention and more input than with other services for the same amount of money, but also you're getting efficacy rates that are in the 50, 60, 70% range, not in the 15, 20, 25% range. And, the classic tagline is, a psilocybin journey is equivalent to about 10 years in therapy, which, you could debate that, but let's say that's true, for argument's sake. How much does 10 years of therapy cost? So it's hard because it is actually really good value for the money for what people are getting and the results they're getting. And I'll tell you, the results I've seen is that people who have been struggling 6, 8, 10, 12 years or their whole life with something and never seen any significant progress beyond disease management. I've just already seen so many lives deeply transformed in a way that no other therapy out there is capable of doing. So when you look at it through that lens, really, it's priceless. But the economics of it at the end of the day is you have to you still have to have money to pay for services, and we have to cover our cost. So this is one of the biggest challenges, I would say, to everything outside of the conventional medical system and the current funding mechanisms that are in place, because we don't actually have funding mechanisms in place for cure or for health. We only have funding mechanisms in place to manage disease.
Well, I think your quip earlier about people being used to algorithms as opposed to alternatives is very valid in this particular context. And I think the other challenge in being expensive to be able to provide it, being expensive for somebody to access it, is part of what pushes people to the underground, which is a little bit risky and dangerous, especially if you don't know the person well. That you've got some person. I don't want to generalize. There are people out there that are doing this very responsibly in the underground. There are people out there who are doing this very unresponsibly in the underground. I was lucky that when I accessed this stuff for the first time, that I found somebody who, in retrospect, did a very good job in terms of integration, setting, and uh, preparation, setting, and integration. Um, I'm curious if you see that a lot, or whether the continued expensive cost of being able to access these will continue to keep a very lively underground going.
I think here in Colorado, that's something I've heard directly from other people who have been through the same training program that we have. Is on the back end of their training as they go into the expense and the logistics of trying to set up and do this within a licensed regulated framework. The costs of trying to provide it are so high that a lot of people are like, I should have just stayed underground, right? And it's unfortunate because the bureaucracy of it and the regulation of it, which is, regulation should be there to keep patients safe and keep care effective. But the unintended kind of side effect here, or I'll say it's an adverse event,
Yeah, there you go.
is that we are actually taking people who want to work in the regulated space and we're driving them into the underground because it's too expensive for patients, and it's also too expensive for providers. So that's one of the biggest challenges I would say right now in the psychedelic assisted therapy field as this evolves. Yeah, and it's a big hurdle to overcome. And yeah,
Part of it feels intentional, and I get that because if you charge, for example, the state of Oregon charging, say, $10,000 for a grower's license, that's going to dissuade a lot of people. And perhaps the people who are really willing to go through the effort of doing and going through all their wickets, and I'm sure the Oregon wickets are very similar to the Colorado wickets in terms of all the things, including, for your clinic, what's your plan for making this accessible to people with lesser resources? Anyway, perhaps in that way, it was intentional to keep the number of people looking for licenses low. I don't know. What are your thoughts on that?
I don't know. I have mixed feelings, and I'm gonna fall to the side of optimism. I think that there are a lot of really good people out there who, the best they know how, are trying to make sure that this is a safe and effective modality. And my experiences with the committees and the government bodies um, here in Colorado is I think that most people have really good intention, but we've been really entrained that things have to be controlled to be safe. And I don't think they're intentionally trying to keep the number of providers low. I think they're trying to keep standards high, but the impact, or either the intention is there or not, the impact is that they're going to keep the number of clinics and providers low. Now, this is a problem because 1 in 4 American adults has a diagnosable mental health condition. We are in a mental health crisis. I got started in healthcare kind of through a public health, through a public health channel, and I also have my master's in public health. And I'm always thinking about, yeah, like I want to, like, individually as a provider, it's always about the individual sitting in front of me. But when I step back from the individual, it's always like, but how do we address this at a level that actually makes a change for the whole? And if you want to just talk about numbers, the number of providers you would need to actually address the mental health care crisis in America to provide care for 1 in 4 adults and 1 in 3 teens is monumental. And this approach to trying to address it, I mean, it's like, you know, trying to kill a pterodactyl with a fly swatter, you know? It's just like, as far I mean, on now on an individual level, it makes a huge difference and it's worth it for each individual that benefits it. But when I step back and look through my public health lens, like this is a drop in the bucket in the current framework, and we need to do better. And mental health conditions are the leading cause of like disability and missed work days in this country. We can't afford not to address this as a society. And at the same time that I'm sitting here saying these words to you, we are actively dismantling the resources and systems and structures in place to address public health in any meaningful way as a nation.
That's a whole nother podcast right
Not that I
there.
want to shift things political, but
Yeah.
like one of my favorite slash most hated public health kind of statistics to share is that we spend twice as much per capita um, in America than any other nation. I think it's like 18.1% or 2% of our GDP goes to healthcare in America. Second, the runner up on that is Switzerland, and it's like 9.1 or something like that, if I remember the numbers correctly. We spend twice as much as per capita as any other nation, and we consistently rank 30th out of 30 of the most developed nations in the world in our healthcare metrics. So clearly, the system and structures that we have in place are not solving the problem. And also clearly throwing more money at it isn't also the solution. Because I mean, the healthcare industry is a black hole. It will gobble up as many resources as much money as we'll throw at it. And in fact, there's a lot of the places where there's the most profit generated off of healthcare is in the places that it's the most wasteful and inefficient.
Well, I think that goes to show it's not the money, it's the paradigm that that we're working under, and it simply doesn't work.
Yeah, and it's hard, like politically. And again, I don't want to go down that road. I agree with the left in that I really do believe that healthcare is a human right, and that by investing in the health of our population, that we are stronger and richer as a nation. Just like we realize when we educate our whole population, all of society benefits, and it actually grows our wealth, our GDP, et cetera, et cetera. The same is true. Like, we're not going to grow our economy and our workforce and our industry if we have a whole population where 1 in 4 uh, workers has a mental health condition and then also multiple physical health conditions, right? So I do think that this is something that should be provided as a public right, but I do not think that the system that we have or the funding mechanisms we have in place are the way that we're going to achieve that. So I feel torn because, man, uh, it's just not working, and we can do better, and Americans deserve better than this.
They do, and that's part of the reason why I do what I do, and I know that you do what you do, is to get the message out that there are other ways to address this. I want to shift gears a little bit. When I applied for the IPI program, the Integrated Psychiatric Institute, where I got my psychedelic-assisted therapy certificate from Boulder, they were not accepting naturopathic doctors for their curriculum, and I understood their reasoning. It was that you needed a counseling background in order to be able to facilitate the preparation and the integration that is required from doing psychedelic-assisted therapy. And I found out that there was one ND that went before me, and that particular individual put me in contact with somebody that within the system, the application system that I could talk to. And I ended up having a really long interview with her and explained to her the type of education that we received. Ryan and I went to Bastyr University in Seattle, and counseling is like we did a whole counseling shift together. I completely forgot about that part. The summer of
That's
2018.
right. That's
Right, right. Ryan and I were in a room together, learning how to give people like mental health counseling. And I ended up getting in the program after explaining what it is that naturopathic doctors are and how we do it and the type of training that we receive. It was frustrating to again, think about being excluded because of the letters behind my name, but at the same time, after having the interview, I was accepted. And since then, I think a number of naturopathic doctors have been through that program. Um, I, I mention this because I think naturopathic doctors, and we went through one of our nutrition classes together too. I remember specifically, we were the Hot Pockets. Do you remember that?
that was our group name, wasn't it? I
Doing one
totally
of our Yeah, doing one of our nutrition. Anyway, so we
incredible
weren't
there.
yeah, we weren't eating Hot Pockets. But anyway, the level of other modalities that are so important in integrating from these things. I think naturopathic doctors are one of the few professions that bring all of that together. Counseling, nutrition, mental health. And we talked yesterday quite a bit about the nutritional aspect and the neuroplasticity. I want you to have the same conversation with my audience that you had with me about why nutrition is so important in integration.
Okay, well, I'm gonna get there, but let's hit pause on that because you had multiple points before that that I do want to speak to, and I really want to be clear about this um, for everybody who out there who's less familiar with naturopathic doctors and how we're trained. And we are trained as primary care physicians, and we go through almost all the same training that medical doctors and DOs go through, apart from, we have less training in emergency care and hospital based care. But as far as primary care and outpatient services, we get all the same training. We get all the same basic sciences. We have to jump through all the same hoops and learn all the same things. And on top of that, we get training in all the other modalities, including in mental health. Okay, we get trained extensively in mental health. I was having a conversation a couple of years ago with one of my friends who is an MD who trained at Harvard and is the director of a family medicine residency here in Denver, Colorado. And he told me, again, as a Harvard trained MD directing a family medicine residency, that every time a mental health case comes in for a visit, that he's terrified because he has no idea, because he had almost no training in mental health. Maybe a quarter in psychopathology and maybe a quarter in psychopharmacology, familiar with the DSM and the diagnostic criteria and the algorithms. But beyond that, very little training. And if I recall, we had 5 to 6 quarters of training in mental health. And we actually had counseling rotations and counseling, shifts that we had to sit there and actually counsel just like an LPC or an LCSW. And on top of that, we also learned nutrition and herbal medicine and medicinal mushrooms and exercise. I mean, we just it goes on and on. I mean, our education was ridiculous. And I testified last year at the state capitol. And I was highlighting all of this when we were trying to get a bill passed. And as far as with natural medicines here, like psilocybin, I do not know of another profession that gets training in physical health, mental health, and medicinal mushrooms and using plants and botanical medicine, like all of those, but then also in clinical, pharmacology to know how those natural medicines are going to interact with their Prozac, right? What their effects are. Like there is, in my opinion, there is not a better profession out there to implement um, the Natural Medicines Health Act or other iterations of that in other states, psychedelic-assisted therapy than naturopathic doctors. We are the only profession that gets trained in all the areas that I think are requisite to really provide that care at the highest level possible. And then to sit there and, I had to fight last year with, as they were doing the draft rules, to make sure that naturopaths were included in the list of professions that could be, considered as a clinical facilitator here in Colorado. And it's really frustrating. So that was, I wanted to speak to that and just really say that explicitly. And actually, if there's any NDs out there listening, I've just noticed that amongst a lot of NDs, there is this hesitation to take a step into the mental health care space. And I don't really know where that comes from. And I just want to encourage any NDs out there that you are well trained to work in this area and you have more training than a lot of your conventional counterparts and colleagues in this area. Step up. We have a mental health care crisis going on in this country, and we cannot afford to not have you on the job because nobody else is stepping into this gray zone where so many patients are falling. And I'm tired of that. We need to step up and own how well trained we are, and how able we are to address these needs.
I would go one step further because there's a lot about mental health that we either don't acknowledge or don't recognize, and how much of that is due to things like nutritional deficiencies, B6, zinc, all those things. And with the ability as a naturopathic doctor and the training in nutrition, we might be able to unpack a mental health case that isn't a mental health case.
Yeah. Yeah. And that's what I see all the time. And like I said, this is the area that I work in. I guess it's kind of become my specialty. Um, and mental health is really complex, but it's also rooted in our physical health. And if the brain doesn't have the basic nutrients, the basic ingredients it needs to have optimal function, then how would we expect the mind to be in a balanced, healthy, and functional place if the organ of the brain that supports it doesn't have what it needs to function? So there's a metaphor, or kind of I guess it's a metaphor that I use a lot with my patients to explain all the different modalities we use at Neurogrove and how they work together. So if you bear with me, I'd like to walk you through it. All right. So these are the modalities that we're going to talk about. Um, biofeedback, neurofeedback, um, laboratory testing, nutrition, um, ketamine assisted therapy, psilocybin-assisted therapy, IV therapy. Again, we're back at the buffet. We've got all of these things. So how do you pick which combo of things is the right thing for you? So we have to have a framework for understanding this. So I want you to step back and think about this through the lens of a vehicle, an automobile. Okay. Automobile is a complex system that all works together and has various components that do very specific tasks, all of which are essential to get you safely down the road. So biofeedback, I really think of as the gas pedal and the brake. We have the sympathetic nervous system and the parasympathetic nervous system. For people out there who don't know those terms, sympathetic is the fight and flight response, parasympathetic, rest, digest, heal, reproduce. In short, the gas pedal mobilizes energy and speeds us up, and the brake pedal of the parasympathetic nervous system slows us down and puts us into a place of resting and digesting and healing. Okay. So we have this nervous system or autonomic nervous system that has these two components. Biofeedback is all about training people on how to use the gas pedal and how to use the brake, right? So that we can use those in the appropriate times. Like, imagine you're in rush hour traffic driving through a major city. What would happen if you stepped on the gas pedal and it got stuck down and wouldn't come back up?
You're going to have chaos. Yeah.
Same thing. What if you tap on your brakes lock up, you come squealing to the halt in the middle of a 75 mile per hour zone on the interstate during rush hour? Someone's going to run into you. So it's not that, the gas pedal's good and the brake pedal's bad or vice versa. It's that we need to be able to effectively switch between the gas pedal and brake based on the real conditions around us. Okay. So that is all about biofeedback, is teaching us how to use the gas pedal and the brake pedal on our nervous system in really practical ways. Like breathing techniques, mindfulness techniques, muscle relaxation techniques, very practical ways. And then whenever you hear feedback, whether it be biofeedback or neurofeedback, there's something actually measuring that process in your body and reflecting that data back to you so you can see how your nervous system is changing in real time, right? This is not woo-woo. This is not out there. This is not fringe. This is basic anatomy and physiology, folks. Like, there is nothing alternative about this. This is basic anatomy and physiology.
Well, I'm going to interrupt for just a second. One of the things I love about biofeedback is just very basic stuff. It's skin temperature and respiration rate and heart rate.
Right. And they're all proxies for our stress response. Right. And if we are in fight or flight or not. And you can measure that in very objective ways. Now, neurofeedback is a little bit more nuanced. Our brain has electrophysiological activity that you can measure with an EEG in real time. And there are different frequencies. So whenever you are down in delta, that's like being in first gear. That's really slow, right? But also, like, it's very slow and torquey, let's say, like first gear, right? There's just because it's slow doesn't mean it's not powerful. Delta is going to be associated with rest and healing, right? And your brain cleaning house. Now, when you get all the way up into sixth gear, high beta, the highest, fastest frequency, that's going to be like intense focus, right? But you're going to see an elevation of that with like anxiety and nervousness, heightened attention, right? And then alpha is kind of like third gear in the middle, where you could go faster, you could go slower. It's a very adaptable mid-range gear. So biofeedback and neurofeedback are like the engine and the transmission paired together. Okay. Now, one of the things we're trained in as NDs is in physical medicine, right? And so a car also has to have a chassis, and the chassis has to be in good shape to provide a platform for the engine and the transmission to get the power to the wheels. So body work, physical medicine, osteopathic, chiropractic, naturopathic, manual therapies, that's all about the body of the car, right? But then you also have to have fuel in the tank. And what do you think the fuel in the tank that runs and gives the power to the brain for it to be able to do these things? That's nutrition. And there's macronutrients, which is like fuel in the tank, but there's micronutrients, which are also like the coolant and the lubricant and the power steering fluid and the brake fluid. We have very, very specific needs for our brain. Omega-3 fatty acids, phospholipids like phosphatidylcholine and phosphatidylserine, We need magnesium. Like we need all of these trace minerals to fire. And those trace minerals are like the spark plugs in the engine. And if you don't have any spark, you don't have any power. Okay. So now let's take one step further back, right? One step further back is a car's only going to go someplace if there's a driver, right? So where does counseling fit into here? Counseling is the driver, is helping the driver behind the wheel actually see the conditions of traffic and be able to interpret them correctly and respond to them in a way that's actually serves them well. And so, like we have to have all of these components in place. And that's why a lot of our mental health care interventions are so ineffective because they only deal with the transmission or only deal with the engine or only deal with the driver in the traditional counseling model, right? And it's not that simple, right? We need to understand health and mental health at all of these levels to really produce deep and lasting change. And they always say, oh, like you're not allowed to talk about cure in mental health. It's like, well, maybe the reason that we haven't had actual cure in mental health is because you're only trying to fix the transmission and doing nothing about the driver, or you're only supporting the driver and you don't give a crap about the engine. Like, cure is possible in mental health. It happens all the time, but we have to have this integrative approach to deal with all of that.
I had a patient sitting on my couch earlier this week who said we were going through his review of systems, talking about his mental health, and he said, "I have PTSD, but I've been told I'm in remission." And I'm like, "What does that even mean? Like, can we just say that you're better and you're not having night terrors anymore?" Um, anyway, that's just an aside. It makes me chuckle. Like, cure is a dirty word in allopathic medicine. Um, and I
And
don't know that
especially
we'll
in psychiatric medicine.
Yeah, and I don't know that we'll ever be 100%. I think welcome to being human on planet Earth, but I think we can have a quality of life that is vibrant and vital, despite all the things that are thrown at us. And so we can heal, just like naturopathic medicine says: remove the obstacles, um, e- enable the V's, the natural healing, force that we have within us. Um, so for people So for people that have really complex illnesses, I think the message is you can't just look at one thing. That's part of the reason I love what you do is you and you may not even find that person in one naturopathic doctor. Like, you may have to have a team, and that team might include somebody who can talk to you on nutrition, somebody who can talk to you about mental health. But it would be ideal if you could have somebody who was looking at the whole case for you, helping kind of as the executive director of the medical plan, if you will, to help drive the show, because people aren't medical experts. They need a medical expert to help with all this stuff. And I think that's part of what it is you're doing.
I think you've just perfectly highlighted the role that indies could and should be playing in the healthcare system. We are the bridge between mental health and physical health, between conventional and unconventional, or whatever we want to label it, medicine. We are the ones that can take a step back at that 30,000-foot view and see, all the different levels of health, from environmental and social all the way up to, the physiological, and integrate them all together. I think that's the role we should be playing, and that's the role I'm trying to play. And to, um, like I looked up some statistics earlier this morning, and there are so many conditions that do not neatly fit in the mental health or physical health bucket. So, post concussion syndrome, or people who have experienced a TBI, in the 12 months after your first mild TBI, individuals who have no history of anxiety and depression, up to 50% of them will develop anxiety or depression for the first time after their first mild TBI. IBS, 70 to 90% of individuals with IBS also have a mental health condition, which is much higher than the general population. Think I've maybe only seen once or twice in my career someone with IBS that didn't also have anxiety. Um, a third of individuals with chronic fatigue syndrome also have mental health, a diagnosable mental health condition, and up to 80% of individuals with fibromyalgia have a diagnosable mental health condition. And then we could start talking about functional neurological disorders and functional gastrointestinal disorders. I mean, we could go on and on, down chronic pain, um, even down to orthopedic conditions with the way that your nervous system holds tension in your muscles, which pulls you out of alignment, which, you know how it is. I don't have to explain this to you.
Yeah, absolutely. It's a lot of this is the chicken or the egg, like which one was, and that takes somebody being able to get to the root cause. So I've seen people with mycotoxin poisoning, black mold, that develop depression and anxiety. I've also seen people with depression and anxiety because they've had some sort of trauma develop chronic pain. But being able to find that root cause is really important in fixing the whole car.
Yeah, absolutely. And again, the one of my hesitations about using that car analogy is that it's pretty biomechanical, and we're operating like the way we're thinking is a level above that. But that's why I include that driver, right? And there's not just the driver in the car, but then there's the road, right? And that's where the public health side of me comes in too, because our health doesn't end at the border of our skin. And I would also go so far as to argue that health is not individual, it's collective. It's a collective phenomena that we experience individually. And our health is dependent on our relationships with other people, our connection with the environment, the air we breathe, the water we drink, the people who grow our food. One of the reasons that I think that our healthcare is so ineffective is because we treat everybody as individual little packets of health. And that's not the way that works. Health is a systemic phenomena that is shared and does not end at the border of our skin, right? And that's why treatments and interventions that end at the border of our skin are never going to heal us. They're just going to manage disease, and we deserve better than to just have our diseases and our symptoms managed. We demand health, not lack of disease. And there's a difference there.
Absolutely. All right. There are so many other places that you and I can go. If I continue this podcast long term, we're definitely going to have you back on. But we are unfortunately at the end of our time. I'm very grateful to have you on. I think the work that you're doing in Colorado is amazing, and I look forward to seeing how it grows and blossoms in the next 5 to 10 years. So thank you, Ryan. I appreciate your insights and all the things that you bring to the table.
Thank you. It's my pleasure as always. Great to reconnect, and yeah, just a privilege here to share my knowledge and experience in this area. And even with the knowledge and experiences I have and the training that I have, I still am just one part of a really complex puzzle, and we need collaboration and cooperation between all these different modalities and these different professions and all these different backgrounds if we're going to really make a significant impact on public health. And yeah, no one profession, no one person, no one modality has it all. So let's figure out a way to make this all work together like a 5-course meal and not like the Golden Corral buffet.
All right. So if you are in the state of Washington, I am located in Paulsbo and Port Townsend, out on the Olympic Peninsula. You can find me at meridianpassagewellness.com. You can find the alternative flight plan all over the place. Check us out on LinkedIn, on YouTube. We're on Apple Podcasts now. I'm so excited. You can find the alternative flight plan on the Apple Podcast. So if you are in the state of Washington and you want to consult with me one-on-one, check out meridianpassagewellness.com, book now, and you can get a session with me. Ryan, over to you. Where can people find you?
So my practice is located in Arvada, Colorado, which is just a little bit west of Denver. So for seeing me as part of my integrative practice, you can go to www.neurogrove.com. Look up Neurogrove on Google, you'll find us. And you can visit me there. My healing center license and psilocybin work is out of Transcendent Integrative Health, and the website for that is transcendent.health. That's it, no .com at the end, just transcendent.health. And shoot me an email with any questions you have, and hopefully I'll get to connect with you soon, and we can become partners in your...
Fantastic. And our last plug, because my producer would be disappointed if I didn't say this, please, if you like what we're saying, hit the like button, share it, subscribe, and more importantly, I think the share part is really important, because if we have a good message and people need it, having you share it is going to help them find it. So thanks very much for listening. This is the part where I put in the cheesy naval aviator speak and say, all right, we're going to roll into the groove and we're going to catch an OK3 wire and land back on the carrier and go grab some mid-rat. So thanks very much for listening to the Alternative Flight Plan, and be well. Thanks.